Again, this is Melissa Cleater, and I am the program manager here at the National Fund. Thank you all so much for joining us. I'm going to ask for a full mute. Okay, that feels better. Thanks. If you haven't already, please mute your lines. So today, I appreciate you all carving out some time for this really important conversation and attending the second of the CareerSTAT Employer Best Practice webinars in the series. This is 2 of 6, so take note. And today we are here to learn how workforce development professionals in the Chicago area are approaching racial equity and inclusion in COVID-19 recovery and beyond. Before we get to the good stuff, I do have a little bit of housekeeping. So if we could go to the next slide. So these are primarily for folks who are using both a computer and a telephone to participate today. When you log into Zoom on a computer, you are typically automatically connected to your audio. So in order to prevent some of that weird feedback, we ask that you disconnect from your computer audio, which you can follow these instructions here by finding that little caret and then selecting leave audio, leave computer audio from those options. Next slide. We also have a little bit of instruction on how to connect your phone to your video, which is something that's really helpful for us on the back end. And the way that you do that is by being sure to enter your participant ID number when you are calling in on the line. So you can find that number both in the registration confirmation email, but it also comes up in this pop-up box. So if you were to join it, audio, you should get a little bit of the pop-up that's to the right, and you can see the 2 participant IDs there and enter that when you call in. Okay, next slide, please. Okay, so this is just a real high-level overview of what we're going to cover today. First on the agenda is welcome. That's happening now. Welcome. I'm so glad to have you all here with us today. And if you could please use the chat function just to type a little hello with your name and where you're calling from. It is really great for us to be able to see who's joining us from all over the country. So appreciate you just taking a minute to say hello in the chat. And we can see everybody and appreciate that. And then we're going to dive into the content with Chicago overview and then hearing from 2 employers about what's happening on the ground for them. There will be an opportunity for audience questions. And I encourage you to use the chat function to ask those as they come to you and top of mind. But just note that we might not get to them right away and it might come later, or it might happen then, depending on the questions and where we're at in timing. So appreciate your flexibility there. And then we'll just have a quick wrap up and reflection at the end. So next slide. There we go. So this is great. So I want to provide just a little bit of context before getting into the introduction of our panelists today. Racial equity and inclusion has been a surge topic for quite some time now, for the last couple of months. For some people, the public health and economic crisis and the video recordings of violence against Black individuals really shined a light on racial disparities and ignited calls for a national reckoning of the long history of race-based injustice in this country. But for others, the impacts of systemic racism are known and understood through daily lived experience, and the fight for justice is something that spans generations for them. So regardless of where you are on this continuum, we have a real opportunity in this moment to have a paradigm shift on how we think about equity and how we might be able to move that work forward in a more candid, a more inclusive, and a more action-oriented way. If you attended our previous one, you may recall that Joanne Pikowski talked about how she was really able to secure a seat at some very important internal tables by making the case that workforce development is a fundamental strategy organizations must use to expand diversity. So while we are facing tightened belts in terms of budgets, the work there is immensely important. But we also know at the same time that traditional train in place problems are not they're not going to solve diversity and inclusivity challenges within an organization. In really order to move the needle and retain people of color in those positions and move them up career ladders where they have more power and decision making within an organization, we must address the cultural and organizational practices that are really rooted in white supremacy. And so I hope today's conversation really sparks some ideas about how you might be able to take some of the things you learned here today back to your organization and how that might best meet this really integral and important call to action. So I am very excited to have Team Chicago on the line today to really hear about their work to address racial equity in the Chicago area and how that may or may not have changed post-COVID. Adrian Esquivel from National Fund site Chicagoland Workforce Funder Alliance will provide an overview of the Chicago workforce development landscape and its response to COVID-19 and racial equity. And then two healthcare employers are going to share their perspectives about what's happening on the ground in their respective organizations. I'm really thrilled to have Nicole Gilson-Barrymore from Rush University Medical Center join us. Rush was recognized as a frontline healthcare worker emerging champion in 2009 and is a participant in 2019, and a participant in CareerSTAT's current Healthcare Workforce Development Academy. And then we also have Clayton Pryor with Advocate Aurora Health with us. And Advocate was a participant in the first Academy cohort and then was recognized as a frontline healthcare worker champion in 2019. And he also provides technical assistance to cohort 2. So we have a real great group of folks here who I think have a lot of interesting things to share. But before we dive into all that really good and interesting content, we want to hear a little bit from you first. So if we could have the next slide for polls. And our first poll is really just trying to get a sense of where folks feel about their organization's response to racial justice movement. So do you feel that your organization responded appropriately to this current call for action around racial injustice? And we'll have a few minutes for you to be able to answer there, and you could go from strongly agree to strongly disagree. And we'll give it a second. And Josh, when you feel like we have critical mass, go ahead and share the results of that poll. Okay, so it seems, that we have a good chunk of 46% of folks who agree that there was an appropriate response. And then there are some still areas, room for improvement there with, neutral, so not really sure where they fall in that, and a handful that agree or disagree or strongly disagree. Okay, so for our next, we have one more question for you all in a poll. And it's whether or not you feel equipped to advocate, whether that's for yourself or other people that you work with who have experienced any type of acts of racism or microaggressions, negative acts or statements based on race or any other identity that might not be the mainstream and can be a focus of a little bit of discrimination. So again, you can agree strongly to disagree and see where folks are falling on that continuum. Just a few moments of awkward silence while we wait for our poll results to be published so we can all see kind of where folks are at. Okay, so it seems like a little bit more of a disperse. We have a couple leaders at the top that feel strongly agree, but majority both either agree or strongly agree, and then a few more folks in the different continuum. So I think this is a really interesting perspective for us to hold as we dive into this really good and important conversation. So without further ado, I am going to pass it over to Adrian to tell us a little bit about what's going on in Chicago.
Great. Hi, everyone. Can you hear me? Like thumbs up from those of you, camera?
Yeah.
Cool. All right, awesome. So my name's Adrian Esquivel. I'm with the Chicagoland Workforce Funder Alliance. We're the Funder Collaborative, the National Fund affiliate here in Chicagoland. I'm just going to talk a little bit about who we are and what we do, what our role has been in supporting the Chicagoland Healthcare Workforce Collaborative, which you'll hear a little bit about today as well, and then talk specifically around how we've been thinking about racial equity both at the Funder Alliance, the Chicago Community Trust, which is the community foundation where we sit in the Chicagoland area, and then also think about how we've been working on that prior and now post during COVID, and then turn it over to Clayton and Nicole, who are some great partners and doing awesome work. So the Funder Alliance, we're a funder collaborative. I'm sure many of you are familiar with what those are. 14 different workforce development foundations in the Chicagoland area who focus on workforce development, pooled resources to form our funder collaborative. And our overall mission is to increase employment, earnings, and racial equity for underserved and underprepared workers in the Chicago region. And the racial equity piece has been a part of our mission statement for a few years now as well. And we could probably do a whole other hour on kind of our journey through figuring that out and how we try to manifest that. But we specifically wanted to call that out specifically as part of something that we need to do a better job about, and also acknowledge what are the systemic barriers behind much of the work that we're trying to do on a daily basis. So we do our work through a number of different ways, but one of them specific to today, the context of today, is around these industry workforce partnerships, sector partnerships, and specifically in the Chicagoland area, we help financially and administratively set up the Chicagoland Healthcare Workforce Collaborative, of which Clayton at Advocate Aurora, Nicole from Rush, and many others in the region are members and leaders of. And a little bit of that origin story was we're trying to figure out sectors that were ones that we could invest private philanthropy in to advance the spirit of the mission that we're talking about with promoting racial equity, and bringing employer partners along in order who wanted to work on those issues as well too. So I will say that as we started to bring that up, and in the Chicagoland area, the context is that there's a long history of segregation, racism, both structural and personal, and an unfair allocation of resources in the Chicagoland area that's happened for generations, like in many other parts of the country and world. Also, while the murder of George Floyd brought a lot of this during the COVID, brought a lot of this work up in the COVID time, in Chicago, the murder of Laquan McDonald years prior also started a conversation, or restarted another conversation in the Chicagoland area as well. And I bring these stories up to say that, tragically, it's taken these murders and the publicity around them to change a lot of the dynamic. And I'm just being very candid on, and from what I'm viewing in the Chicagoland region. So it's not so much that there weren't organizations or people thinking about doing this work or wanting to do this work, but for it to have the greater piece, I want to just document and bring up the tragedies that unfortunately created the moment we're talking about here. So at the Community Foundation in Chicago, the Chicago Community Trust also has a new mission statement, which is to close the generational, racial, and ethnic wealth gap in the region as well. So it's a 10-year strategy plan as well. So it's been remarkable to see naming racial equity and naming that as the root cause of a lot of the employment and violence and other challenges in our community as being a driving, if not the driving force behind a lot of this inequity. So now that we've named it, I think we're starting to get to this place of what do we actually do. And now in this era of COVID, a lot of the private, so what's been happening within the workforce development landscape, and then I can speak from philanthropy in the landscape in the Chicagoland areas, there's been a lot of tables and a lot of convenings around how resources should be allocated. And I think the hope is that we're at this moment where we're no longer just creating tables and making statements, but actually getting towards these root causes. And some of the work that's happening within the Chicagoland Healthcare Workforce Collaborative is trying to get at those root causes by specifically changing the systemic barriers that have kept certain people out of employment. And that's something that I'm really excited to be a part of, and work with great partners like Clayton and Nicole and others who kind of see that systemic need, while also understanding that working within institutions, the programmatic change that happens can happen at different paces. And that, I'll say that, like, I have a background in organizing and I work in philanthropy, and I often feel like my organizing background is used more now in this job, finding the mutual self-interest of employers and community organizations and philanthropy and activists who are on the ground trying to make change. And I think at different periods of time over the past few years, sometimes you feel like you have to disguise conversations around diversity and equity and inclusion. So the fact that we're naming it now is substantial progress, but I continue to think about this as an opportunity to continue to move forward with this work as well. So I'll just pause there. If maybe there's any questions, but and I can go into more specific technical pieces about what these funds look like and who's at the table and what we're looking to fund, and happy to go into that as well. But I just kind of wanted to give an overall kind of picture of the way that we, as a funder collaborative housed at a community foundation in Chicago with a history of segregation and racism, is thinking about this moment and viewing it and connecting it to the work that's been happening for a few generations.
Great. Thank you very much, Adrian. And so now we're going to foray into the interview portion of this webinar. I am no Sally Jesse Raphael, but I'm going to do the best that I can to keep us engaged and motivated during this part of it. So my first question, I'm going to direct towards Nicole, and I would love to hear just a little bit more about how did your organization and how did Rush respond to these, renewed calls for racial justice?
Yeah, so I think that this is somewhere that a place that Rush really stands out. So Rush has always been committed to our anchor mission. And so our anchor mission is all about utilizing our economic power as an organization to drive change, to drive all of the systemic issues that we see within our community. So we've always been rooted in diversity and inclusion being an important part. But as Adrian mentioned, I think calling it out and naming it for exactly what it is and taking a bold stance is something that Rush has done. So one of the first things that we did in the light of COVID-19, where we see the pandemic is highlighting the exact issues that are coming from structural racism. And our organization specifically calls out the challenge as structural racism. And I think that naming it so boldly as an organization is something that Rush stands out in. So you will see, if you drive around the Chicagoland area, marketing that specifically states that to Rush and to Chicago, Black Lives Matter. And it is as point blank as that, and taking our stance is something that I think I'm very proud of to work as an organization. But that came out of a lot of reflective conversations. So as soon as the murder of George Floyd happened, the leadership team at Rush got our organization together, held a forum with over 1,000 employees to understand and reflect. And I think that what is different now is really about not only talking about how we can come together. Chicago is the smallest big city, we always say. It's a big city, but from a workforce development standpoint, we are a tight-knit group, which brings about a lot of power when it comes to decision-making, policy changes. But I think that what was unique about the current state is we had this opportunity to have these conversations and the self-reflection of looking at your organization and all of the aspects of that. We can dive into that later in the call, but looking at the organization and saying, hey, where are we good at, and where do we have a lot of work to do? Rush has been very focused on this for quite some time, and we still have a lot of work to do even within our organization. But I think calling it out spelling out exactly what we stand for is something that has really been brought to light given current circumstances.
Great, thank you. And just quickly, I got a follow-up. So when you talk about those 1,000 employees that were engaged, can you give me a sense of, like, was that a cross-section of employees? Was that leadership? What did that look like? Oh, we can't hear you. Are muted. You muted.
Sorry. Thank you. I have to do it on both my phone and the computer. That is a really great point, Melissa. Is one of my recommendations is you guys are looking at your organizations, how can we make a difference? And as Rush has put it, be the change. We really have to have a diversity at the table. So from frontline staff to the C-suite, we actually put together a racial justice action committee that is very inclusive of the different levels of the organization, different backgrounds, experiences, clinical, non-clinical, you name it. And it's really a system approach because we know that we have to be strategic about this. We also have to set objectives. And so we have a huge campaign about how do we help individuals understand their individual responsibility to changing our current state, and also providing a table for them to have a voice and make recommendations on making a change.
Great, thank you. Now, kicking it over to Mr. Pryor, Clayton, what has your organization done? What are things looking like at Advocate Aurora?
Sure. First, just want to say kudos to Rush for your bold stance and some of the work that you're doing. Has been very visible here in the city of Chicago. Very similarly, there was a lot of work that was happening prior to kind of the racial injustice kind of uprising. I really feel like this current climate just made it a little bit easier to have difficult conversations around racial equity and diversity. And really what the role of an employer is, kind of driving back to our anchor mission work, and really looking at some of our roles and kind of the role of an employer in helping to remove some of those barriers, which some of us did not know were systemic barriers, right? Based on some of the things that have happened across our city with redlining and lack of access, transportation, all of the things that impact individuals as they are trying to get to a livable wage. And there is a business impact to that as we deal with turnover and shortages of workforce, et cetera. So just kind of having that type of conversation, I feel like the current climate has made that a little easier. So our immediate response, our CEO sent out an email that was pretty much internally facing, kind of deploring any racism in addressing the George Floyd's murder. But he also made a statement that we as an organization were going to double down on diversity and inclusion from a resource and investment perspective. So we had been on the journey for a little while. We have a diversity and inclusion team, and we have a D&I learning team, and have been on the journey for some time. But I think this put a little bit more of a focus and a priority on us as an organization and what we need to do in order to rise to the occasion of what's happening, and even understanding some of the gaps that we have. One of the immediate things we did was implement a real talk session. So this was a virtual session. It was a 90-minute session that any team member across the organization could sign up for, that was facilitated by leaders throughout the organization. And it really was an intentional step to get people to the place of being comfortable having uncomfortable conversations and understanding where people were, how they were feeling, and really getting to a place that we could organically come up with solutions to address racial inequities within our communities, but more importantly, within our organization. And without that baseline information, it's hard to do so. I think a lot of organizations have the ability to get in a boardroom with individuals who lack diversity and kind of say what they think is best, right? And we do that as leaders all the time. We kind of say, hey, we're going to do this, we're going to do that. But the real talk sessions, in my opinion, was a great way for us to go to every layer of the organization to understand people's experiences, and then really take that feedback, roll it up into the organization, and start to look at programming, services, initiatives, policies, and all those things that could really help and change and move our organization forward. So we've done some things. We got a lot of work to do, but that was kind of our initial step.
Great. Thank you. And quick follow-up. So like from those conversations, do you have an example of just like one concrete idea that came through those conversations that is getting acted upon, right? Because I think we have lots of, engaging your employees and getting worker voice is very much a best practice. And while I think many organizations get step one, the step two of actually what are you doing with that information? Lag a little bit. So I'm curious, and maybe it's too soon to tell, but I'm curious if you have any concrete.
So I definitely think it's a little soon. I think that we're at the place that we just kind of finished the first phase of the conversation. So all that information is kind of being synthesized and pushed out. We are in the process of making recommendations. I can say one quick one that came out was the unconscious bias training for everyone. So we had that training that was available. Now it's mandatory for leaders, and just kind of pushing that kind of training and learning. Another thing that came out was, leaders not feeling equipped to have those conversations with their team members. So how do we better equip our leaders to have those conversations and to help remove those barriers and support people where they are, given that we had kind of these two things that were happening, right? So COVID and kind of the racial injustice thing. Chicago, like a lot of cities, got hit really bad with the looting and some of the protests, and there was a lot of derailing to our norm, which some was good, some was bad. But how do we support people who couldn't get to work, who couldn't do what they needed to do? So that was a lot of the conversation, but I think there's more to come on tangible solutions that will be long term.
Great, thank you. So that Nicole, you guys, well, for both of you, you guys are doing these learning sessions, right? And like getting a lot of information. And Nicole, for you, what have you learned during this time? And specifically, how has it impacted workforce development within your organization?
Yeah, so similar to Advocate, Rush hosted a survey taking a pulse on how does racism play out in our own organization. And I think that this speaks volumes to the organization to really be able to put yourself out there and say, hey, where can we improve? So in relation to not only the action committee, but also the overall survey, we have a lot of outcomes and work to do, similar to as Clayton had mentioned. What I've learned over this time is that there is the importance of vulnerability and really the growth, the importance of growth, and the tie to workforce development is so close that we cannot separate them. We have to speak to them in one, and we have to make sure that they're sustainable. What I mean by that is we have several programs that we work with the collaborative that are much more sustainable, even in trying times of the COVID pandemic. And thanks to Adrian and his team, we're able to not worry about, are these programs going to be able to sustain all of these changes? One of the things that is on the table right now at Rush, and something we're still doing a lot of work on, and many of you, I'm sure, at your organization, we've seen a total shift in the workforce landscape. And so our strategies might not be exactly where they need to be. We have to totally reassess. And I think in that reassessment, we have to we have to include diversity and inclusion in that conversation. They cannot be separate. They have to work together. And so I think the more that we can create sustainable structures where, and for example, one idea or one way Chicagoland does that is we actually offer a pathway program across organizations. And that allows each organization to be able to put resources in, but not necessarily cost the same amount, because we have shared resources across what some would see as competing organizations. In Chicago, those are my expanded teams. And so that's one example. And I think that we really need to structure programming in that sustainable fashion to be able to get through changing times. The other thing I learned is really about making sure that you are able to measure your successes. So right now, given the light of the COVID pandemic, it is very important. Everything is under a microscope. Finances are tight. And we need to be able to articulate how is this investment, why is it good for not only the community, but also the organization. As healthcare organizations, we are driving health, and we know that structural racism is deterring that. And so we have to do something about it, but measuring it and being able to articulate that is extremely important during this time.
Great, great. Clayton, do you have anything to add about that in relation, more than what you just kind of gave through the survey? Were there other learnings, that are, impacting workforce development specifically?
Yeah, I mean, I would agree with everything that Nicole said. I think the biggest thing that I would add is I think it just helped to level the conversation. As a workforce development professional, sometimes you can feel like you're on an island with, trying to integrate the D&I and equity work and just kind of the community perspective. And I think sometimes we as people have limited perspectives on how we understand how things came to be, especially in our urban cities. Again, as you go back to, redlining and lack of access in so many different ways. So I think it's given a platform to our work that has allowed me to go and ask for additional resources, not necessarily always monetarily, but even just organizational resources to combat this. And then to Nicole's point, tying it back to the ROI as we think about how it impacts our organization. So to me, it's given a great conversation piece and helped to forward the work that we were already doing.
Great. So that sounds like, this has kind of opened a way for folks who previously didn't quite make those connections and are doing more learning about the history of Chicago, the history of the country, and how there were very specific and intentional things put in place to keep people marginalized and untapped and within those communities. And that in this moment, that there are more people, particularly within leadership, who are hearing that in a different way, or at least learning about it and understanding it, that makes leveraging workforce development as a higher priority to be able to address.
Absolutely. And I wouldn't limit it to leadership. I would say across the organization and our functional departments and talent acquisition, just as we think about people who are in key positions within the organization. So, yeah.
Certainly. So I imagine even like with your frontline managers, right? Like so many times, we look at the individual as failing, right? And that you are late for work and you can't show up on time and you can't figure out your childcare. But this is showing that it's actually a systems problem. And if we want to help that individual, we have to look at the water picture there.
Absolutely. And I think one unintended consequence of this overall is it kind of has helped to level the playing field. So no matter if you're the vice president or if you're a frontline cook, everybody's kids are at home because all the daycares were closed. So it helped give you a different respect for people trying to make it work. And I think that's just a conversation that needs to continue. And how do we help to remove those barriers?
Great. Okay. And so, you both alluded to, that this is work that has been going on for a while, that, it's not your first day, but it also feels like it has shifted in some kind of way and has become a higher priority, better resourced type of issue. And so as folks who have been doing this, what advice do you have for other organizations who are really trying to make that case internally and want to prioritize racial justice within their organizations?
Yeah, so I'll start, and Clayton, I'm gonna get my notepad out and steal some ideas as well, right? And that's why I'm excited to have this call with so many leaders across the nation. Is we have a lot of work to do. I think my biggest advice is you've already started the journey just today of being honest with yourself. So today when we took that first poll and it was like, hey, I'm not feeling equipped. Acknowledging that and understanding that is step number one. And I think that sometimes we're afraid to say that. Even myself, I always have continuously goals for personally to improve on my own implicit bias and how that shows up in the workplace. So that is number one. The other thing I would recommend at a more organizational level is to really be cognizant of what are the outcomes that you're looking to drive. And the reason I say that is because if you're intentional about what your goal is, you can measure it and what measures gets done. And so I think one of the other things Rush has done that has really enabled me to take the wheel and run with it is to set goals so I can say, hey, this is a strategy. This is something that we're working towards. Even if that's not at the overarching organizational level, we can do that from a workforce level. So starting with something of targeting specific communities, that's, you know, where we started. And now we're looking at overall as the organization, how do we continue to drive this and making sure that we're hiring locally, that we're buying and sourcing locally and interconnecting all of the work. So for us, our communities on the west side of Chicago, we made that lofty goal of reducing the life expectancy gap by 16 years, by 50%. There's a 16-year gap. And so I think that, yes, you might not get there overnight, but if you start within workforce development and driving those results, it will have a ripple effect.
Great.
Yeah, I agree with everything Nicole said. One thing I would add, and what I love about Rush, is they've done a lot of work in kind of identifying life expectancy gaps from what we would consider downtown through the west side of Chicago, and then kind of every step of the blue line showing the difference. So I think for me, it's really about identifying the lay of the land in your respective areas. So being armed with information about your unemployment rates, your black and white unemployment rates, your kind of poverty rates, your different things that are kind of your labor market information related to your workforce, and then kind of using that to help understand it. I think you can also connect it to, depending on how your organization is structured, your human resources from a talent acquisition perspective. You can also connect it to your community strategy, your community health goals from a social determinant of health perspective. So I think you have to find your angle, you have to find your in, and I think that depends on the culture of your organization. But I think that's kind of ground zero, and that will help you get started.
Great. So we have a few questions here from the chat. And before I go there, but just, I'm curious, Adrian, from your perspective, right? As a convener, working with multiple constituents kind of across the city, what advice might you have for people who are in that similar role to you, right? You're having, these are conversations that they're talking about that are challenging internally. You're having conversations with employers as a partner, and whether or not you have any advice for folks who are trying to engage, on a regional level, how they might be able to work together to address these systematic issues.
Yeah, and that's a really good question. I mean, just speaking from the place of working for a funder collaborative at a community foundation. I mean, I think one of the things to do is just to be really explicit about language and about where we're coming from, and as a result, have the ability to be a leader in that way, to kind of almost like provide cover for anybody who doesn't feel like they can say that piece, or their institution can't say that piece. And I think by being the person in the meeting years ago and saying racial equity is part of our mission statement in my introduction every time, puts that out there. And I don't know where that's going to land with everybody at the time, but I think that the accountability that we have is different than the accountability somebody else has in an institution. And I think being able to financially support and put resources on the table, or direct them to places to do this work, and kind of assume risk in different ways, if it's audit risk, or if it's reputational risk, or if it's personal risk. I think that's leading into that privilege that comes with just working for a foundation in that way, and being able to just put that out there and not feel like, that's just been one way that I think that I've kind of seen that. I mean, then also I think just trying to drive a conversation to understand the structural, and not that people aren't doing that already in their institutions, but just continuing to affirm the structural challenges related to racism, as opposed to it just being like a moral failure of the people, but understand that there are structural reasons why this continues to happen, and doing that. And then also within philanthropy, needing to do the work internally as well. So it's one thing as a foundation to say we promote racial equity and want to close the racial and ethnic wealth gap, but institutionally and internally as well, philanthropy has been a contributor to that historically as well, and also needs to fundamentally change itself as well. So I think those are just kind of, and being reflective about that and being able to be honest about that journey as well, I think are some of the things that I think should go.
Yeah, so that really sounds like taking on that risk of being a leader and being explicit about what your values are, and the values are anti-racist. And as a funder, as people come to you, they know that that's a value you hold, and that's an important, so that's just a way of reinforcing that from a leadership perspective within the community, to say, like, this is a value statement. This is why this is important for this work to be done. Okay. Great. So moving over to this, I'm going to bounce around these questions. So Nicole, there was a few questions around the survey, and one person was, interested if you'd be able to share the questions used in the survey, or if you have any recommendations for the type of questions that will help us also stay compliant with HR requirements.
Yeah, so definitely able to share some of that out. I think the key thing and themes within the survey really revolved around taking an internal look at the organization. So, have you experienced feelings of racism within the organization? I think blatantly calling that out is a question. I'm pulling them up right now. I think the other piece of it is really understanding where they're at, right? So from an individual standpoint, making sure that they're taking the time to reflect. And so there were a lot of open-ended questions on that. From an HR perspective, I don't have a lot of concerns. I'm interested to see where some of the concerns are from organizations. At Rush, HR, we did look at it, but it is something that was very reflective. And then it was also an idea generating survey, right? So very open-ended, like, how can we do better? What are your ideas to improve? In fact, it was the employee's idea to take such a bold stance on, having a marketing campaign that specifically says, like, Black Lives Matter, and then literally within a week making that happen. And so I think we utilized it as an idea generating, a self-reflection tool, and then it also helps kind of a needs assessment of where do we need to train, where do we need to focus, and also how do we hold each other accountable. So happy to share in more detail if people would like to offline, but those are the general themes.
Okay, great, thank you. Okay, so let me see here. So Adrian, Kelly was liking what you had to say, and she was curious if you have any specific success stories to share, and what type of backlash that you may have experienced, if any. And I will say there that I'm assuming, with working with employers, but Kelly, please chime in if there's a little bit more specific.
Yeah. Happy. Okay.
Employer specifically. So she's looking
Okay.
for employer specifically. Thanks, Kelly.
Thanks. So successor. So yeah. So I think, well, with some people on the call, absolutely, we found success, and I think there's and kind of one of the other questions in the chat I saw was around entry level positions, and I think there's this medical assistant pathway program that Nicole has been a really big part of, and others that the Funder Alliance financially supported, that got a bunch of got 4 employers engaged in thinking through what are these actual systemic problems that are keeping entry-level workers from moving up in a career pathway program. So I won't talk about the specifics of that as much because I don't work in the hospital, but we were excited about that because we actually saw employers investing time, money, resources, and in their own workforce to change policies as well. And then also the group as a whole, the Workforce Collaborative as a whole, started to identify what are actual barriers to employment, beyond things that you will always come up, like, oh, it's a skills gap thing, or, but actually, like, what are actual barriers? And if you're trying to have a more diverse and reflective workforce in the Chicagoland area, like a lot of parts of their country, Black and Brown communities are policed differently, and so as a result, people get criminal records at a rate that's different than white individuals do, which then keeps them out of the healthcare profession because of legal or administrative or whatever barriers to actually getting employment. So getting employers to recognize that as an issue, and actually hearing employers say, we actually would be okay, working with, with hiring from a pool of people who have criminal records, but we don't know how that works. So it's just, you see all these systemic things that are in the way, because then if you think about the public workforce system, and you have somebody come to them and say that are incentivized strictly on placements and retention, if you have somebody come into your workforce agency and saying, I have a criminal record, you're not going to get the healthcare pamphlet. You're going to get the pamphlet to an industry that traditionally, putting that in quotes, traditionally is more open to hiring people with records. So I think getting all these like systemic players on the same page about what are actually some of the actual barriers and getting employers to start to signal that has been, I would consider that a success. Backlash, I mean, I think, you know, it's a little bit different now than it probably was a few years ago, but I think it was just, there's just always the backlash around, you know, tone, or like moving too fast, or, you know, or don't want to make somebody, you know, uncomfortable when you have, in my opinion, generations of people who've been uncomfortable because of racism. So I think like those are some of the kind of the backlash that, you know, that we would face. But I think it's been generally, I've been really happy with the, you know, a lot of the work of the collaborative as well.
Add something there. I think one thing, speaking specifically to the individuals with records, one thing that's I think been great about the collaborative is that we've had the opportunity to kind of opt in and out based on the level of comfortability with our organization. So we have a lot of organizations who are more conservative, and we went out the gate with a particular project. You may have had some that said, hey, I'm all in, and you had some that said, hey, I need to sit back and wait and see what happens and take this data forward to my leadership team to get their buy-in. So I think for us, I think we've had that kind of good rapport that has allowed us to do that, which to me has diminished some of the backlash, potential backlash.
Yeah, and I think we.
Yeah, and I would.
Go ahead.
I was just going to say, Melissa, I'm sorry. I was just going to say that I think that is part of the strategy of partnering. So if I could recommend, I know Boston does a great job of this as well, is coming together as organizations. There is kind of this like little bit of peer pressure thing, but also the availability to opt in and opt out makes it a very big pro for collaborating. I think the other piece of that has to do with, if we're going to truly change systemic issues, we have to do it together. Rush can't do it alone. Advocate can't do it alone. Chicago can't do it alone. I think that's what makes this group powerful. And so the more you can collaborate, the more influence, the more economic power you have to make a difference.
Great. So we do have a couple of great questions in the chat that I'm going to try and get to, and just we only have a little bit of time left, so I'm going to just flag that in responses, right? And so one is, you know, the pandemic really has put a tremendous financial pressure on a lot of healthcare organizations. And so how is this impacting your ability to provide the development opportunities for your entry level staff, right? Who are often very ethnically diverse. A question around HAA's virtual conference of CEOs is next month. Is there some way that we might be able to elevate this issue on that forum as well? So just, I think that's a tad bit, but just let's figure out, you know, yeah, funding is real. A lack of, you know, a pause in those elective money generating services and all of that. So what has that looked like? As you know, someone like Clayton said, they're doubling down. What does that actually look like in terms of the resources and the impact on workforce development?
I'd say you hit it on the head. I think as an organization, there have been a lot of challenges that have come along with COVID-19. I think our CEO's commitment to doubling down allowed us a platform to position ourselves and our work as a pipeline for diverse talent into the organization. So we're still in the process of going through our request and kind of building our story, but that kind of opened the door to the conversation to say, if we're going to make a difference, here are tangible solutions for us to be able to make an impact in these areas. And I think another layer of that is not only our entry-level individuals, but it's also when we do see gaps in diversity and leadership, how do we mitigate that gap? Part of that is developing your internal talent so that they have the skills and education to take advantage of those roles. Being more intentional with our recruitment efforts in these, you know, minority communities, and we know that the talent exists. How do we access them? So it's really been for us leveraging those words and kind of what we've been looking to do as an organization, and just presenting tangible solutions in order to do so. So hopefully the next conversation I'll have a praise report of more funding for our programs, but at least that's the approach we're taking.
Yes. And so I think you touched on this next question a little bit there, right? Is that the lack of racial, cultural, and linguistic diversity among clinicians is a huge problem and will require very significant and sustained investment and commitment to move the needle. Where do you think the leadership and resources should come from? And do you know of any promising practices or success stories? And if that is too big for this amount of time, you let me know and we can get an answer offline.
I'll let Nicole take that one.
I can't unmute.
You're not, we can hear you.
Oh, okay, good. I'm like, it's not working. So I would say one of the things that is really important when you think about that is thinking about the specific relation between diversity and inclusion, racial injustice, and COVID. They are not unconnected. And so we have to drive it from a clinical standpoint, and we have to be very focused on that. Healthcare is a very credentialed organization and industry. And so if we are going to really highlight to make investments even in tough times, we have to be able to look at each of those specific situations. COVID and the impact on communities, specifically our Black and Brown communities, is directly related to structural challenges and structural racism. And so we have to make that connection first and foremost. I think the other piece is that gets back to partnership. And we have to partner to be able to infiltrate those areas. And the reason being is because those are high investments. We need people like Adrian and his team to be on board as well, to be able to at least show results up front. So that way we can continue those investments, but they have to be intentional.
Great. Thank you so very much. I think we're going to turn back to our reflection. There was a lot of good information and conversation here. I really appreciate the engagement in the chat, and would ask, just for you guys to think about, what is one thing you heard today that really resonated with you or sparked a new idea, something that you are excited to either learn more about or take back and have some conversations internally. If you all could just tap a little bit of that into the chat function, we would love to capture what was tangible and good about this that you might be taking back to you. And while you folks are thinking, there's one more question around, from an HR perspective, how can you integrate racial equity ideals from a recruitment standpoint without being discriminatory? And I know that may or may not be for you guys specifically in your roles, but.
Yeah. So, I mean, I think there are a couple of ways, but just anecdotally, I think it's being more intentional on how and where you recruit, and being mindful of, minority organizations and historically Black colleges and places that you can get leadership that reflects the diversity that you're looking for. Another way is diverse slates. You can have diverse slates and making sure that you have at least that type of representation in the candidates that you are moving forward with. Those are just a few. I mean, I'm not technically in talent acquisition, but those are a few that I can add to the conversation.
Okay, great. And thank you all for sharing these tidbits coming through the chat. I appreciate you. And we just have one more slide here to go to, a little promo for what's coming up next. So, this theme around this webinar series has really been around engaging employers and learning, those three big buckets of job quality, racial equity, and COVID response and recovery. And so please save the date for the next webinar, which will happen September 16th on Wednesday. More information and registration links on that will be coming out soon, so keep your eyes peeled. But again, I just want to give a big thank you to all of our presenters for sharing all of that insight and wisdom that you all have. I hope you all found this to be, educational and inspiring. That is my goal at all times. So I am open to feedback also that you may have. We have 4 more left in this series, and if you would like to see something different as participants, come at me. I'm ready for open feedback, just like Russian Advocate. I'm ready and ready to hear it and take it to the next level. So thank you all very much, and I hope you have a wonderful afternoon.